Hello, I'm Dr. Michael Lipcan, Chief of Gastroenterology here at Griffin Health. Your GI provider recommended you have a colonoscopy, and I'd like to take a few minutes to review what to expect from this procedure. I hope this information will make the process smoother, easier, and less stressful. Your medical care is our central focus at Griffin, and we believe that providing information will make you feel confident and comfortable with your healthcare decisions. Please keep in mind that your GI provider and care team are always available to answer questions and provide further clarity. A colonoscopy helps us detect and prevent colon and rectal cancer by finding polyps and removing them before they turn into something far more serious. Therefore, again, by removing polyps, we reduce the risk of future colorectal cancers. This test may also be recommended if there are any symptoms which raise concerns regarding the health of your colon, such as abdominal pain, diarrhea, constipation, rectal bleeding, or weight loss. Finally, a colonoscopy may be recommended for follow-up of conditions like inflammatory bowel disease, colon polyps, or cancer. Each year, over 16 million people in the U.S. have this procedure, and complications are very rare, actually far less than 1%. To perform a colonoscopy, all of the stool must be flushed out of the colon so it could be thoroughly examined. You will receive clear, step-by-step instructions before your procedure, including dietary guidelines and how and when to take the bowel prep. You will have diarrhea. Your bowel movements will become more liquidy as all of the debris is washed from your colon. A clean colon makes this test quicker, safer, and more effective, so following these instructions carefully is very important. From the time you arrive at Griffin for your procedure to the time you leave is usually about 3 hours. Just before starting your colonoscopy, you will be asked to sign a form confirming your willingness to have this procedure. Then you are sedated with IV medications, and a thin, flexible tube with a light and camera on the end is inserted into your anus and gently advanced to examine the inside of your colon. Once we start, the test itself takes around a half an hour, and when patients wake up, most say it feels like a brief, peaceful nap. Post-procedure discomfort is very unusual. If any polyps were removed or biopsies were taken, this material is sent to the lab and takes about a week for the tissue analysis to return. This does not necessarily mean something is wrong, and your gastroenterologist will follow up with these results when the information is available. Again, after your procedure, we work hard to be sure this information is clear and understood. Because of the sedation, please plan to take the entire day of your procedure off and arrange for someone to bring you home. For your own safety, you're not allowed to drive the rest of the day. After your procedure, we recommend you eat lightly the rest of that day. Please don't try to make up for what you didn't eat the day before. And please keep in mind that it may take up to a week after your procedure for your bowel pattern to normalize. Of course, after your colonoscopy, we ask you to contact us promptly if you are experiencing any pain, bleeding, fever, or any other concerning symptom. We've just reviewed some generalities regarding a colonoscopy, and it's also important to know that every patient's experience is unique. As you move through this process, your initial consultation, pre-procedure prep, procedure and post-procedure period, if you have any questions or concerns, please ask. Speak up to your gastroenterologist or any member of your GI care team. We want to be sure you have all of the information you need to feel safe and in control of your healthcare decisions. Thank you again for trusting Griffin with your medical care. We're honored to be part of your healthcare journey.
Griffin Health. Empowering people. Advancing care.